You might be wondering, am I pregnant? Well, the first week can be a whirlwind of anticipation and curiosity. While it's too early for a pregnancy test to detect anything, your body might already be giving you some hints. Let's start from the very beginning, where the magic of life begins. Conception. It all kicks off when a tiny sperm meets an egg, creating what we call a zygote, just a single cell. This little zygote then begins its journey down a tube in the female body, called the fallopian tubes, heading towards a special place, called the uterus. About 6 days later, the zygote arrives at the uterus. Here, it does something incredible called implantation. This means it sticks itself onto the wall of the uterus, getting ready to grow into something bigger. Now, let's talk about what someone might feel during this first week of pregnancy. Keep in mind, these things can be different for everyone, and some might not feel anything unusual at all. 1. Spotting. Early in pregnancy, some people might notice a small amount of blood, like when you see a drop on your fingertip. It's not like a regular period flow, more like a little hint of red. This can happen because of something called implantation bleeding, which is when the tiny baby-to-be snuggles into the lining of the uterus. During the early days of pregnancy, it's not unusual for a few drops of blood to appear, resembling the tiny droplets you might see on your fingertip. It's not as heavy as a typical period, just a subtle hint of redness. This occurrence is often referred to as implantation bleeding. Picture it as the beginning of a cozy nest-building process for the baby-to-be. As the little one settles into its new home in the uterine lining, it may cause a slight bit of bleeding. It's like a gentle announcement, signaling the start of a remarkable journey. If you happen to notice this faint bleeding in the early stages of pregnancy, there's usually no need to worry. It's simply a natural part of your baby settling in and getting ready for the incredible adventure ahead. 2. Tender breasts. Sure, here's a simplified version. Early in pregnancy, your body goes through changes, especially in your breasts. This happens because of hormones, which are like little messengers inside you. They make your breasts feel different, maybe tender or swollen, like they've been gently pressed. This tenderness is normal and shows your body is preparing for something special. Your breasts act like signals, telling you something's happening inside. It's your body getting ready for the journey ahead. So, if your breasts feel tender during early pregnancy, don't worry, it's just your body adjusting. These changes are natural and part of the amazing process of pregnancy. Your breasts are getting ready to feed and care for your growing baby. So, instead of worrying about tenderness, see it as a sign your body is doing what it needs to do. As pregnancy goes on, your breasts will keep changing to prepare for breastfeeding. Hormones make milk-producing glands grow and increase blood flow to your breasts, making them feel fuller and heavier. Besides tenderness, your nipples might get bigger and darker, and you might feel tingling or sensitivity. These changes are normal and happen because of hormones and more blood flow. To feel better, wear a supportive bra that doesn't squeeze your breasts too much. You can also try warm compresses or baths and gentle massages. Remember, breast tenderness is just one of the many changes your body goes through during pregnancy. It might be uncomfortable sometimes, but it's your body getting ready for motherhood. 3. Feeling tired. During the first week of pregnancy, feeling more tired than usual is completely normal. Your body is working overtime to accommodate all the changes happening inside. This process requires a tremendous amount of energy. Your body is undergoing various transformations, such as hormonal fluctuations and the establishment of the placenta, which is essential for providing nutrients to the developing embryo. Additionally, your metabolism may increase to support the growing demands of pregnancy. All these changes can leave you feeling drained and in need of extra rest. Moreover, emotional and psychological factors can contribute to fatigue during early pregnancy. The realization of this life-changing event, coupled with concerns about the future and physical discomforts, can add to feelings of exhaustion. Therefore, if you find yourself feeling unusually tired during the first week of pregnancy, it's important to listen to your body and prioritize rest. Taking short naps, delegating tasks, and practicing relaxation techniques can help manage fatigue and support your overall well-being during this transformative time. Remember, your body is working hard to nurture new life, and it's perfectly normal to need some extra rest along the way. 4. Feeling sick. Feeling sick when you're in the early stages of being pregnant happens to a lot lot of moms-to-be. Some may not feel it at all, while others might feel sick or queasy, especially in the first few weeks of being pregnant. This feeling, called morning sickness, can happen at any time of the day, not just in the morning. Morning sickness usually starts around the 6th week of pregnancy, but it can be different for everyone. Stats say that about 70–80% of pregnant people feel some level of morning sickness. Doctors aren't exactly sure why morning sickness happens, but they think it's because of changes in hormones. When you're pregnant, your body makes more hormones like estrogen and HCG, which help the baby grow. But these changes can also make you feel nauseous or uncomfortable. Morning sickness can show up differently for different people. Some might feel a little sick on and off during the day, while others might throw up more often. It can also vary from one pregnancy to another. Dealing with morning sickness can be tough, but there are things that might help. Eating small meals more often can keep your stomach from feeling empty and help with nausea. It might also help to avoid spicy, greasy, or strong-smelling foods. Drinking enough water is super important when you're pregnant, especially if you're feeling sick. Sipping on clear fluids like water, herbal teas, or ginger ale can help you stay hydrated and feel less queasy. Some people find that sucking on ice chips or eating plain, whole foods like crackers or toast can help too. Besides changing your diet, there are other things you can do to feel better. Getting plenty of rest, avoiding things that make you feel sick, like strong smells or motion, and trying relaxation methods like deep breathing or meditation might help. Even though morning sickness isn't fun, it usually means everything's going okay with your pregnancy. Studies show that people who have morning sickness might have a lower chance of losing the baby or having other problems during pregnancy. So even though it's hard, morning sickness is often a sign that your body's doing what it needs to do to raise your baby. Understanding why it happens and trying different ways to feel better can make it easier to handle. Getting help from your doctor and taking care of yourself can help you feel more comfortable during your pregnancy journey. 5. Mood swings. Emotions can be like a bumpy ride, sometimes making us feel like we're on a roller coaster. During early pregnancy, these feelings can get even more intense because of some hormonal changes. It's like one moment you're smiling, and the next you might feel easily annoyed or upset. Feeling more sensitive or irritable during this time is normal. It's like your emotions are turned up a notch, reacting to even the smallest things. These mood swings happen because your body is adjusting to being pregnant, and it's like it's trying to find its balance. But here's the thing, while pregnancy can cause mood swings, they could also happen for other reasons, like stress. That's why if you think you might be pregnant, it's a good idea to take a test to be sure. It's like putting the pieces together to understand what's happening inside your body. And remember, it's okay to talk to someone if you're feeling overwhelmed by your emotions. Lastly, during this first week, it's super important to take care of oneself even before getting a positive pregnancy test. This means eating healthy foods, drinking enough water, moving the body regularly, and avoiding things like alcohol and cigarettes. During the first week of pregnancy, your body might start giving you some clues, like spotting, tender breasts, feeling tired, or even a bit queasy. These are all signs that something special might be happening inside you. While it's too early for a pregnancy test to confirm, listening to your body and taking care of yourself is crucial. Eating well, staying hydrated, and getting enough rest are essential steps even before you get a positive test result. Remember, this is just the beginning of an amazing journey, so take care of yourself and stay healthy. If you found this information helpful, please consider sharing it with others who might benefit. Your support helps us reach more people and spread awareness about early signs of pregnancy. Don't forget to leave a comment sharing your thoughts or experiences, and subscribe to our channel for more informative content. Together, let's empower each other on this incredible journey of pregnancy and parenthood.